I don't know if we should wait for some few minutes or we should just go ahead. For those who have not joined us yet. Mr. Adeyele, can we go ahead or wait for some few seconds or minutes? Okay, all right. Um, I'm happy to be here again, and I'm happy to be the anchor for today's session. As we all know, we usually have this once in a while, but I mean, it's been a while we have this regular session. And I want to thank our lecturers, our professionals that take us on these beautiful sessions. I also want to thank Nigerians, all of us members of this beautiful community that give support and also attend these beautiful lectures. I pray that we are united continuously and we see good and better things even in the future. My name is Joyce Ezigbo, and to many of us that don't know me, my name is Joyce Ezigbo, and I've been anchoring this session for a while now, alongside other people that anchor sessions like this for NIWT. And I'm glad again today for being the person that will be anchoring this. I want to welcome everybody once again, and then I would like to also introduce our professional today that will be taking us on this beautiful session. So it's no other person than the person of Dr. Khadijah Abdurrazaq. Okay. I mean, for those who have, I mean, she has been here for a while now. She has been here before. She has taken us on several sessions, but this is another beautiful one, and I'm happy to be present today. So for those of us who are here and have not heard about her before, I will try to give a brief introduction of who she is, and then she will take over and give us a 30 minutes um, session on this class today, and after that, we'll ask questions pertaining what we have, listened to. So Dr. Khadija is our own and is a healthcare provider based in Midland here, Texas. She specializes in pediatrics and has expertise in several areas, including routine checkups, immunizations, and development and child development, and varying childhood acute and chronic conditions. So for everyone who is concerned about, because most of us have children, if you're concerned about ways to go about the health of your child, you can consult Dr. Khadija, and she's available and open to assist. I would boldly say that she is the pediatrician for my kids, and she has been doing wonderfully well. With that being said, I would like to leave the floor for you, Dr. Khadija. Thank you so much and welcome to today's session. Your mic is not on, ma. You're muted. Okay, let me see. You're muted.
Doctor, he's on the Zoom, not on the computer. He's on the Zoom. Yeah, the Zoom, you are muted on the Zoom. Yeah, we're going to give Doctor a few minutes to technology can be funny. Yes.
Yeah, on.
Go ahead, ma'am. Thank you, ma'am.
Thank you.
Yes, ma'am.
Yes, ma'am.
All right. How about now?
Yes, yeah, we can hear you now.
All right. Thank you once again, Mrs. Segzebo, for your beautiful introduction, and thank you for the technical support also. I hope my screen is visible. I tried to share the slides. Is that visible?
Yes, ma'am. We can see
It
it.
is very visible. We can see it.
All right. Thank you very much. So I'm Dr. Abdurrazaq. I'm a pediatrician here at Coleman Clinic in Midland, Texas, and I'm here to present a short presentation on pediatric immunization and vaccines. Just to define the terms, because we tend to interchange vaccine and immunization. Doctors, everybody, physicians, patients, everybody uses the terms interchangeably. The vaccine is the actual product that is being put into the body to trigger immunity, usually in form of a weakened or inactivated disease product that is introduced into the body to trigger the immune system. Vaccination is the act of introducing the weakened or inactivated pathogen into the body. So the act of the injection is actually the vaccination. And then the process by which the body develops the immunity or resistance to this disease is immunization. So just to clarify that for us, vaccination, and then immunization. And then brief history of vaccination and immunization. So during the pandemic, for instance, there was a lot of hullabaloo about vaccines and immunization in the world, and everybody was afraid to be vaccinated. But actually, the concept of vaccination has been around for over 8,000 years, dating back to Africa, China, India. Healthy individuals were exposed to smallpox virus lesions of sick individuals, so the healthy will prevent illness. So the human nature, the human beings at that time knew that if they get a small dose of the actual disease, it will protect them from getting very sick. So they would expose themselves to lesions of smallpox. The smallpox vaccine was actually developed in 1796. That's a very, very long time ago. And smallpox no longer exists in the world today due to vaccination. So nobody knows anything called smallpox. Those of us that are of the Yoruba culture and lineage would have heard of Shopono, and that used to be worshipped in those days, and it was a god because nobody knew how to deal with this disease. And today, thanks to vaccination, we do not have smallpox anymore. It doesn't exist anymore. Chickenpox parties that was held as early as 1980s, 1990s, early 1990s. Once a child has chickenpox, their parents will hold a party. Healthy children will have a party with the child that is sick with chickenpox so that the child can be exposed to a small dose of chickenpox. It was believed that children, especially that inevitably they will get chickenpox, and it was believed that if they are exposed to a small dose of the chickenpox, they will create immunity to it. And so it was a sort of vaccine, but it was exposing the children to the wild virus for protection without actually knowing how much of the dosage of that virus you are giving to the child, as opposed to vaccination, which actually measures the quantity of the virus that is being introduced to protect for immunization. So what is the importance of vaccination? Why do we immunize? One, definitely for protection. So this is to teach the immune system to fight viruses and bacteria, preventing serious diseases, hospitalization, and death. Because when you are exposed to the wild virus or the wild bacteria, then the body is not prepared. COVID was deadly initially because the immune system was very naive to this original virus. So it was new and it was deadly to the world. Safety. So, like I've mentioned earlier, it is safer to acquire immunity by getting vaccinated rather than being exposed to a wild virus or a bacteria, which can have severe or fatal consequences. Then we have herd immunity. So when a percentage of the population is vaccinated, they help to protect the entire community, including those who cannot be vaccinated. For instance, we cannot give newborns measles, mumps, rubella, and chickenpox vaccines. These are live vaccines. They are not eligible until a child is 12 months old. People who are immunocompromised, who have asthma, who have cancer, those who are receiving chemotherapy, radiotherapy, or other immunocompromised states like HIV, there are certain vaccines that they cannot receive, transplant patients. So these individuals are vulnerable when the large percentage of the population receive vaccine. We are able to protect those who are vulnerable amongst us. So this brings us to what we call herd immunity, and that was what I was explaining in the previous slide. It just means that a percentage of the community is vaccinated enough to protect the entire community. Different diseases have different percentages of the community that needs to be vaccinated to protect the entire community. So herd immunity is the percentage of the population that needs to be immunized against a particular disease to prevent its spread in the community so that we all remain healthy. For measles, for instance, 95% of the population needs to be vaccinated in order to protect the entire community from being sick, in order to prevent an outbreak. Polio, 80 to 85%. Varicella, that is chickenpox, 90% needs to be vaccinated. Interestingly enough, only 50% of the population needs to be immunized against the flu vaccine to prevent an outbreak. COVID, the original one, 66%, variant, 80%. Invariably, that means that not the entire 100% of the population needs to be vaccinated, but enough population needs to be vaccinated to protect our vulnerable ones so we do not fail them when to prevent outbreaks so we can protect our vulnerable population. We have different types of vaccines depending on the disease that we are talking about. All diseases are not created equally, hence all vaccines are not equal. And with technology, new methods of creating vaccines come about. For instance, the mRNA vaccine, which is the COVID-19 vaccine, was a new technology at that time. This was teaching the cells to make a protein that will trigger an immune response. So teaching our body to produce the protein that will trigger the immune response. We have hepatitis B vaccine, for instance. This is a recombinant vaccine that uses a specific piece of the germ. Only a specific piece of protein is now introduced into the body to trigger an immune response. We have live vaccines. Measles, mumps, rubella, chickenpox are live vaccines. There's also a live vaccine of the flu vaccine that is also available. So this uses the actual disease, but a weakened form of the germ, and is introduced into the body to create the immune response. We have the polio vaccine. There's the live polio vaccine that is not available in the United States. That's the oral polio vaccine. And then we have the inactivated vaccine, which is a killed version of the germ. In tetanus, for instance, what is used is a toxin from the germ. So the actual disease is not being used, but the toxin that germ produces is introduced into the body to create an immune response. The ultimate goal is for us to create an immune response in the body so that we have antibodies that are produced and ready to fight when we are actually introduced to the wild virus or a wild bacteria or a wild toxin. Now, of course, why do we require repeat doses? Why not just get one dose and be done with it? Boosters are required because first, the body the vaccine is introduced into the body, we have what we call a primary response. Something like a visitor coming to your house for the first time, that person is not very comfortable. So that person is first being shy. So this is the primary response. By the time that person comes back the second, the third, or the fourth time, they say in Africa, we are no longer visitors, we are part of the family. So that's a similar concept with vaccines. So we have like a primary response. The first exposure to the vaccine initiates that primary immune response where the body begins to produce that antibodies from memory cells. But these are memory cells, they do forget. So what happens? They act as soldiers. They are ready for defense against that bacteria or against the virus. The second time that you produce that vaccine into the body, the memory cells act faster and robustly to the actual disease in the future. Now, because they forget, you have to give another dose to trigger further immunity, to trigger these memory cells, to build them, strengthen them, and maintain higher levels of protection and long-term immunity. So something like chickenpox, you just need 2 doses. The first dose provides like a 90% protection, and then the second dose is what gets you to that 97 to 98, almost 100% protection. So what does the schedule look like? When you take your child to the pediatrician, they tell you to come back on a frequent basis on a timeline to get your vaccine. That is because one dose does not do the trick. You have that primary response, and then you have the secondary response, and then you have to build immunity. So at birth, a baby requires the birth dose of hepatitis B. I'm going to go through that and then I'll tell you what these diseases are. But hepatitis B is what is given primarily immediately within the first 12 hours after delivery. This is important because immediately a child is born, that child is exposed to blood-borne products. Blood-borne products from the mother, sharp objects used to cut the umbilical cord. So the child is exposed already and needs to be protected from day one. The second dose of hepatitis B is given between 1 to 2 months. So when you go in for your 2-month well visit, the child receives hepatitis B, the child receives the rotavirus vaccine, the tetanus vaccine, the Haemophilus vaccine, pneumonia vaccine or pneumococcal vaccine, and then polio vaccine. We tend to repeat series. So as you can see, at 4 months is the second doses of the same vaccines that were given at 2 months without hepatitis B. At 6 months, we give exactly the same set of vaccines again. Tetanus, Haemophilus influenza B, pneumococcal vaccine, your polio vaccine, and then the third dose of hepatitis B is given as early as 6 months. And once you receive the 3 series of hepatitis B vaccine, you are protected for life. At 6 months is also when you are eligible for your first dose of your flu vaccine, which you get a booster dose a month later. And then the COVID-19 vaccine is also given at 6 months. At 1 year, that's when we give your first measles, mumps, and rubella vaccine, because that's when you are old enough to handle live vaccines. Varicella is also given at 12 to 15 months. Your last doses of your Haemophilus B and pneumococcal vaccine, as well as your first FA, are given at 12 to 15 months. 15 to 18 months is when you get, excuse me, when you get your 4th dose of your tetanus vaccine. At 18 months, you finish up your FA vaccine for life. When you go in for your 4 to 6 year kindergarten age, you can see that we are repeating some of those vaccines. That's because your memory cells starts to wane. You need that booster to trigger the immune system as you go into primary school. That's when you get your last dose of your tetanus vaccine until you require 10-year boosters, of course. You get your fourth dose of polio vaccine and you are done for life. You get your second dose of your measles, mumps, and rubella vaccine, your second dose of varicella vaccine, and you are done for life. That second dose is what pushes you to that 100% protection for these vaccines, except tetanus that you have to repeat every 10 years. By the time you are 11, you are boosting up your tetanus and your pertussis, your whooping cough vaccine. At 11 is also when we introduce your meningococcal vaccine, your meningitis vaccine, as well as your HPV vaccine. When you're 16, you get another dose of your meningitis vaccine because again, those memory cells starts to wane. So you need a booster dose at 16 for meningitis. We have some vaccines that vary according to the season. So RSV is a seasonal disease. The flu is a seasonal disease. RSV is relatively new, and we started giving newborns RSV vaccine between the month of October to March. This is because we know that this is the time that the disease burden for this respiratory infection is most high. Pregnant women can get RSV vaccine as opposed to their babies getting it. So if a pregnant woman gets it at 32 to 36 weeks or 4 weeks before delivery, then the newborn is protected. Then, of course, you have your annual flu vaccine and your COVID-19 vaccines. And this is a table showing you the schedule that we just went through. Now, I'm going to do a quick rundown of what these diseases are and why do we need to get vaccinated against them. We have hepatitis B, for instance. Hepatitis B is transmitted from a mother to the child at birth. Sometimes we do test pregnant women for hepatitis B. So the question would be, if I'm negative, why should my child get transmitted? But what if you are negative, but you are false negative, and you are actually carrying the hepatitis B virus? This can be very devastating to a newborn who is going to live the rest of his or her life with liver failure, liver cirrhosis, or liver cancer. There's no cure for hepatitis B. When an adult contacts hepatitis B, they are more likely to recover, unlike a newborn, 90% of which will go on to develop chronic liver disease. Diphtheria, tetanus, pertussis, those are three diseases and 3 vaccines in one. Diphtheria will cause difficulty breathing, swallowing. It is potentially fatal. In this day and age, most of us don't even know what diphtheria looks like anymore because of vaccination. And that's one thing. Most of these diseases do not exist anymore, and we really do not know what they look like because of vaccination. So when the vaccine level in the community starts to wane, it can be very, very dangerous, as doctors may not even recognize what is going on. They have not seen the tetanus in their whole entire lifetime. So if tetanus shows up to a doctor's office, they may not recognize it. Tetanus causes lockjaw, facial contractions, muscle spasms, and seizures. If not treated immediately, it is potentially fatal. The last time I saw tetanus was over 20 years ago in Nigeria. It is immediately treated with tetanus, immunoglobulin, tetanus vaccines, and antibacterials. In this day and age, we would treat immediately in the hospital based on risk factor without allowing the person to present with tetanus. There's pertussis. Pertussis presents with an uncontrollable coughing fit that can throw a newborn into respiratory distress and death, as well as some young children. It's a cough that can persist for months. That is called whooping cough. It's also treatable but potentially fatal. We have Haemophilus type B. This causes meningitis, pneumonia, and a disease called epiglottitis. Again, we don't see these diseases anymore because of vaccination. And we hope to keep it that way. Streptococcus pneumonia causes pneumonia. It's a bacterial infection, actually, and that is what your PCV15 or PCV20 protects against. This bacteria causes pneumonia, meningitis, and frequent visits to the doctor's office with ear infections for children that are not immunized. We have rotavirus. Rotavirus is a very highly contagious virus that causes severe diarrhea, dehydration, fever, and cramps in children. Measles. There's been an outbreak of measles lately in the United States because of lack of immunization. When we fall below that 95% threshold, disease burden increases. So we get outbreaks in the community. Measles was actually eradicated in the United States until 2025 when we started seeing severe outbreaks in pockets all over the nation because parents started refusing immunization. So complications of measles are pneumonia, swelling of the brain and airways called encephalitis, hearing loss, vision loss, and death. Mumps causes fever and swelling of the jaw. Its complications include testicular swelling or testicular mumps, potential infertility in a male, meningitis, again, brain swelling, inflammation, and hearing loss. You have rubella. Rubella is very mild. It causes fever and a mild rash and cough and runny nose. But why do we vaccinate against rubella? Rubella is harmful and dangerous to the fetus. It causes miscarriages, it causes heart problems in an unborn baby, vision and hearing losses, and intellectual disability in the fetus of unvaccinated mothers. Chickenpox causes fever and a rash, and it tends to go away in most cases. But in some cases, it can lead to, again, pneumonia, brain swelling, inflammation, hearing loss, vision loss, and dehydration from not being able to eat. And then there's polio. Polio causes damage to the spinal cord, resulting in paralysis, nerve pain, foot drop, mostly affecting the lower legs. A vaccine preventable disease that leads to paralysis is quite devastating. Hepatitis A is common in the third world countries, also causing liver disease. And then we have meningitis. Meningitis is an infection of the brain. This can lead to blindness, hearing loss, seizures, and difficulty walking. HPV virus is very ubiquitous. So we've all heard about HPV vaccine, and HPV is very, very controversial because parents believe that HPV is required only if you are sexually active. But that's not what HPV is for. HPV causes warts, it causes cervical cancer in women, penile cancer, and warts, and esophageal cancer. You do not have to be sexually active to contact HPV. It is a vaccine that is extremely common. It is everywhere. So we do recommend that children get vaccinated as early as 9 to 12 to be protected for life. RSV vaccine. RSV virus causes respiratory distress in newborn and infants. And then, of course, we all know about the flu. As common as the flu is, we report flu deaths every year in the United States. And then we have pneumococcal. This is a real life story of deaths from vaccine preventable illnesses. And it's very sad. Right here in Odessa, just next door to us here, or right at our doorstep, a child under the age of 5 did die from pneumonia due to streptococcus pneumonia, very vaccine preventable. Measles outbreak in West Texas, Lubbock County, Gaines, Hector County, resulted in 2 deaths. A 6-year-old and an 8-year-old both died from measles. So vaccines are very safe, and we should try to get our children vaccinated. Common side effects: fever, pain, and swelling at injection sites. Vaccine is very, very monitored in the United States. Long after vaccines hit the general population, there's an ongoing surveillance of vaccines as well as the burden of if there's any side effects. There's a website where this is easily reportable called the Vaccine Adverse Event Report Center, and this data is available to the public. So surveillance is ongoing 24/7 with vaccines. There's no link between vaccine and autism, and there's been several studies that has debunked the link between vaccine and autism, and this is present in this slide. My references are from WHO, American Academy of Pediatrics, the CDC, National Institute of Health, and other journals. And I will throw this to the floor for questions. Thank you very much.
Thank you so much, Ma. Thank you for this time. I really appreciate it, and I've learned a lot. And I would start by asking my own question because I want to know at what stage adults stop getting vaccinated, because most of these diseases, I see that some adults even have them. So do we stop getting vaccinated? I know you deal more with children, but adults, don't we also go once in a while to get vaccinated? Or we are we are totally immune to the rest of our lives?
No, ma'am. So you're right. I'm a pediatrician, but no, adults are not immune for the rest of their lives. And actually, the elderly are vulnerable. So the the young adults and the middle-aged adults are good most of the time, and then you get to the elderly where they are vulnerable. And if you are not vaccinated as a child, there are certain vaccines that you can get for the rest of your life. For instance, if you never received your hepatitis vaccines, for instance, you can receive hepatitis vaccine as an adult. You can receive polio vaccine as adults. If I'm not very sure about that, but I do know you can receive meningitis vaccines as adults. So then your tetanus vaccine, you require boosters every 10 years. So if you got your tetanus at 11 to 12, by the time you're 21, 22, you need a booster. Then your same tetanus vaccine again is also eligible for pregnant women at every pregnancy. Adults 65 and older are eligible for certain vaccines like the Shingrix, pneumococcal vaccine. So no, as adults, you are not free from vaccination, and that should actually be a topic that should be presented by an adult medicine specialist to actually go through adult immunization. I think it's an important topic.
Yes. Thank you, ma'am. For some reason, I don't know, I can't even touch the screen of my computer. So if we have questions, we can voice our questions. I may not be able to see and read it. I'm trying to, I can see some questions on the chats, some messages on the chat, but I can't read it. So if we have typed some questions there, let us just try to voice them out now so that she can respond to them. Thank you. Engineer Somto, please.
I want to ask a question on cervical cancer vaccination for adolescents.
Yes.
Do you think that it has any adverse effect on them, on their growth, on their development?
No, sir. The HPV vaccine is very similar to your hepatitis B vaccine that you receive at birth. The concept is very, very similar, and the virus burden is similar. So, no, it does not affect their development. It does not affect their ability to have children in future, and it does not have any adverse effect whatsoever, except that the vaccine is targeting the virus so that whenever they are exposed to the actual HPV virus, their immunity, their immune system, their memory B cells, T cells are ready to fight and protect them against the wild virus because they've been introduced to a protein of the virus and they now have immunity to the virus. I hope that's been able to answer your question.
Yes, he's giving
Yes,
a
ma'am.
thumbs up.
Thank you.
Yes. So the next question, I would like for someone to voice it out, please.
Okay, doctor. Let me read some of the questions that we have here. Hello, doctor. Thank you for your time. Are vaccines free for children without insurance?
Yes. Most of the time, you can get vaccine at the Midland Health Department for free. When you go to the community health services, you can get vaccine for free, usually paying like an administrative fee of about $15. So most of the time, vaccines are free or should be free.
Thank you so much, ma'am. Thank you. There is one here by, what are the type of, sorry, I'm not in the medical field, so you will bear with me. What are the type of meningitis vaccine should my teen get before going to college?
Excellent question. So there are two types of meningitis vaccine. There's meningitis ACWY and there's meningitis B. Meningitis B is considered to be risk-based, and going to college is actually a risk factor for developing meningitis because you are in the dorm, you are in the midst of it, you are exposed to a lot of people. You can sit in a class of 500, 1,000, or howsoever much. So meningitis ACWY, first dose given at the age of 11 to 12, second dose given at 16 before proceeding to college, and meningitis B, which is actually also 2 doses. You get 1 dose, you get the second dose in 6 months after the first dose.
All right, Mr. Iwai, I can continue from here. Thank you, ma.
Go ahead.
So the next question is, how often does vaccine have side effect on children? I've heard of some stories back home where some kids receive vaccine and became paralyzed.
Okay. So back home, it's actually not vaccination that would make a child paralyzed. Most of the time is giving them injectable antibiotics, which they don't need in the first place. So when an untrained individual, an auxiliary nurse, somebody that didn't go to school, but just received training by the bedside, by the roadside, picks up a needle and injects a child right in the middle of the buttocks. So if you look at the buttocks, you cut it into 4. You draw a line through the buttocks, straight down, and you draw another line across it. That straight down line right there, if you inject that straight line, you can inject the sciatic nerve. When you do that, that can cause paralysis. So it is not the vaccine that caused the paralysis, it is the inappropriate injection that was given. When injection is given in the right side, usually the lateral side of the thigh, as we do here, it's very unlikely that the child will get paralyzed from an injection.
And the next question is, for families who recently moved from Nigeria or another country, how can parents know if their child's vaccine record is accepted here in the US?
So vaccines are accepted in the United States from any country in the world. It all depends on documentation. If that vaccine is appropriately documented with the date that it was given and initialed, that vaccine is usually accepted. Some with lot numbers, some without lot numbers, but as long as there's a date and the vaccine, there's a date and the name of the vaccine that was given and an official vaccine record or card, that vaccine is acceptable.
It's tough to.
Any other question?
There is also one question. Actually, that was actually one of the first question, but I think Mrs. Ezegbo missed that. She said, "Thank you for this lecture. Social media always portray the idea that vaccines are linked to autism. Are there research that prove that what really causes autism and how you notice autism in an infant? Also, can adults take the HPV vaccine after testing, perhaps after a pap smear?" Thank you, ma'am.
Okay, so that's a lot of question, and it's a very beautiful question. I had to rush through the last few slides because I was running out of time. So I'm going to go through first the question that asks about vaccine and autism. There has been several studies that debunks the link between vaccine and autism. So there is one study in 2019 that involved 650 children, 650,000, I'm sorry, 650,000 children were studied. And a 2015 study of nearly 100,000 children that found no increased risk of autism following the measles, mumps, and rubella vaccine. So there have been multiple studies being done. And recently there's been another study that is ongoing in which the federal government is sponsoring another study trying to find a link. But the medical field, we all believe that this has been tried and tested, and there's absolutely no link between vaccine and autism. What causes autism is still up for debate, is unknown, and there's research going on that. We do know that autism is not the same in all parts of the world. That means some parts of the world have more prevalence than others. We also know that there is genetic predisposition in which maybe one child in one family would have autism, and environmental exposures to toxins, pesticides are all a contributing factor. So there's no one reason or factor contributing to autism. There could be perinatal injury, it could be right within the womb, or right from the womb, in which a child may have developmental issues even before being born. So there's no known one cause for autism, and there's no link between autism and vaccines, and several studies have debunked that. The only study that created a confusion and tried to link autism to vaccine, that individual actually did, it was a very small study. The study was withdrawn, and that person lost their medical license. Okay. So that is, and that individual was the one that created the confusion in the world today. Secondly, HPV vaccine can be received up to the age of 49 now. Initially, it started in the young. It was 9 to 16 and then 9 to 25. But because of the effectiveness of this vaccine in preventing cervical cancer, it was moved all the way to 49. So women 49 and below can all receive HPV vaccine even after being tested. Any other parts to that question?
Yeah, I don't think there is another part, but Esther, your question, you said they've not answered your question. We omitted it. Can you word your question? Because I can't find it.
It says, how could one, let me see.
So it's a follow-up question. She said, how would one go about receiving the HPV vaccine here in Midland?
Okay, yeah.
Oh, good. So if it's an adolescent, of course, you take the child to their pediatrician. If it's an adult and you go to your GYN, you can get the vaccine. You can also go to Midland Health Department, Hector Health Department to receive vaccines.
Okay, the next question is, Doctor, for immigrant families who may have incomplete vaccine records from back home, what is the safest way to update both children and adults without repeating unnecessary vaccines?
So once you present your vaccine record to your pediatrician would look at the vaccine record. They will determine the time, the interval. Usually, and we actually have computer systems now that are so the manual. We don't do manual job anymore of trying to interpret vaccine. Once we upload everything into the electronic medical record, it will automatically tell us whether the vaccine received was valid for that age. For instance, if a 6-month-old receives measles vaccine, that is considered invalid, right? We'll have to repeat that vaccine if the child is 15-month-old or older. So once you enter it into the computer system, it will tell you what vaccines are valid, what we're giving, and what is required for that age, without repeating what you already received.
All right,
So
thank you
coming
so
into the United States as an immigrant is not an issue as long as you have your record.
So in the place where people don't have records, because sometimes, you know, the situation on how people get here, some people don't even plan it, they just come. So in the place where there is no record, how do they address such situation?
So the schedule I had shown was routine vaccines. For lack of time, I did not include catch-up schedule. So we actually do have catch-up schedule. Again, depending on how old the child is, we do catch-up vaccines. So certain vaccines, so a case scenario, a child is 6 years old, comes into the country, has never been vaccinated or doesn't have vaccine record, certain vaccines will be given and some will not be required. So you will not be getting pneumococcal vaccine, for instance, because your PCV20 because you are older than 5. But you will get your 3 doses of hepatitis B vaccine. You will get your tetanus vaccine, depending on your age. You get your DTaP, and you will not get your Hib, for instance, Haemophilus influenza B, because again, you're older than 5. So these are the way it works. So certain vaccines you'll be considered too old for, and certain vaccines will be considered mandatory to attend school. And that is the catch-up schedule.
All right, thank you
Depending
for
again
that,
on
ma'am.
the age.
Yes, ma'am. So there is a question. I don't know if I should laugh with this question. So Engineer Somtoshi is asking, he said, I also think that for an adult that is already sexually active, she will be tested first before the HPV vaccine will be administered on her. Doctor, please correct me if I'm wrong.
So you would get your routine pap smear, but that should not preclude you from getting your HPV vaccine. So you're an adult female. I'm assuming that's a female. You're an adult female. And adult males too can get HPV vaccine, by the way. So you're an adult female, you go see your gynae. They do swab you, they do your pap smear. That doesn't stop you from receiving your HPV vaccine at that visit.
Thank you, ma'am. The next question is, Doctor, for immigrant parents who may have heard different beliefs and fears about vaccines back home, how can they confidently separate medical fact from myths when making decisions for their children?
So first, I would recommend not to get your medical facts from social media. because that is what's creating confusion for a lot of people. So people go to social media and take whatever is on there as facts. Whereas most of the time, the people who are putting stuff on social media have their own agenda or their own experiences that may be totally unrelated to a vaccine and blame it on a vaccine. And anybody going there to read that will take that hook, line, and sinker and believe that is a fact, whereas the experience is totally unrelated to the vaccine that is given. I would also recommend that if they have any particular fears or myths, to discuss that with their doctor so that their doctor can explain to them properly that the vaccines are safe. If you look at the diseases that the vaccines protect against, I would not wish those on anyone. And I would rather that we put our fears on the back burner and focus on protecting the future generation. So I'm very young, but I've seen a lot. I've seen newborn babies die from tetanus because back home, the pregnant woman didn't go for prenatal care. She went to the traditionalist and didn't get immunized ever or in pregnancy, got contaminated, presented to the hospital with neonatal tetanus, and there's nothing that can be done. That child is going to die. So I'm right here in the United States, not to talk of what I've seen back home. I've seen children in my clinic from meningitis, blind, deaf, unable to walk. This was a child that was actually not born that way. So you can imagine how devastating that is. The child was not born that way, got into a motor vehicle accident, got traumatic brain injury, contracted meningitis, and now deaf and blind, and using a trachea to breathe, a tracheostomy to breathe. But if that child had been vaccinated against meningitis, it's possible that the child may not be in that situation despite getting into a motor vehicle accident.
Yeah.
I want to wish cervical cancer on my enemy. And I've seen women with cervical cancer and women still dying from cervical cancer, particularly in Nigeria. So HPV vaccine is meant to protect against cervical cancer. An example of, I gave a couple of examples in the slide. A 5-year-old dying from pneumonia, from streptococcus pneumonia, has no business dying from that infection. It's not that the child cannot get that infection. We see infections here in the United States, but it should not get so severe as to the point of dying from it. But when the child is unimmunized, the child has no defense mechanism, has no defense system, the child will die. It's like you having an army invading your home and you don't have anything to protect yourself against. So an army enters your home and you got no defense mechanism. You have no soldiers at the front line. So we're talking about your memory cells. You get a tiny little bit of an infection. You get like 1 microgram introduced into your body to train your body to fight diseases so that when you are attacked, you are ready to protect yourself. That is all what immunization and vaccination is about. It's about you defending your front line, having that army, so that when you are invaded, you are ready to fight.
Thank you, ma'am. So I have a personal question that I want to ask for women who, after childbirth, for women who have children, do they get the privilege to get these vaccines after childbirth, especially for this against this cervical cancer
Yes, they do.
here in
All they
America?
need to do is to talk to their gynecologist.
Okay. All right. So the next question is, a lot of us who have had this COVID vaccine, and is it necessary for us to have the booster shots?
I would take that as a personal choice. That's because for most of us, we do have immunity now. So we can actually confidently say that we are not seeing outbreak of COVID as such.
Mhm.
So for the past 6 months in my clinic, we've been testing for COVID and everybody has tested negative. So, but when there's a disease burden, like if COVID is in the community, then I would recommend, get your booster dose. So COVID is now behaving like your seasonal flu vaccine, like your seasonal flu. So we
Okay.
don't get flu vaccine all year round, but we do get flu vaccine around starting September, October to protect us for the winter months. So COVID is behaving in a similar manner. So if we do have a COVID outbreak, then we should definitely get vaccinated. But our little ones, under 2, are the most vulnerable now because they were not born in the during the
Season.
during the COVID pandemic, so they never received COVID vaccine. So under 2 is actually they are vulnerable now, as well as our elderly.
Yes. Thank you, ma'am. So the next question is, can kids be allergic to vaccines?
Yes, and that's why we have the vaccine, the VAERS, the Vaccine Adverse Event Reporting System. On a very, very rare case where a kid is allergic to a vaccine or a kid has an allergic reaction to a vaccine, then that child would not be immunized. So those are the few ones, the vulnerable that we are talking about, where when 95% of us are immunized and we have 5% that cannot be immunized, the 95% have protected the 5% that cannot be immunized.
Thank you, ma'am. And I believe this is the last question. So it says that in Nigeria, we give our babies BCG at birth. When do babies get BCG here? Because my 3-month-old did not get this vaccine.
We do not give BCG in the United States. That's because first of all, tuberculosis is not endemic in the United States. So tuberculosis is not endemic in the United States. It's endemic in certain parts of the world. And when I mean endemic, it's not intrinsic to the United States. It's not a disease that you get by being in the United States. It's a disease that you can bring from outside into the United States. So when you come from Latin America, Africa, South America, Middle East, will test you for tuberculosis to make sure that you are not carrying the tuberculin bacteria. You do not need treatment so routine testing is done on immigrants coming into the United States, and if they find that they are carrying the tuberculin bacteria, then they are treated immediately to prevent them from spreading the infection within the United States. So I think that is the major reason why BCG vaccine is not administered. And it's actually not also believed to protect against tuberculosis. So despite BCG being given widely, people still get tuberculosis. So it's not really believed to protect against tuberculosis.
All right. Thank you so much, Ma. We really do appreciate this session and the wisdom the knowledge you've given us today. Thank you. And for everyone who is here today and you still want to go back to this session, you can find it on YouTube. because it will be uploaded there. Thank you so much, Ma, once again. And we always like hearing you talk to us. I'm so happy that I'm here today. And a lot of us who are looking for pediatrician to handle our kids, Dr. Abdurrazaq is here and she can attend to you. You can also, reach her personally as well, so she can give you directions. So thank you so much, everyone. We have spent our time. It's 7 p.m. now. I wish every one of us a wonderful weekend. Thank you once again. Bye-bye.
Thank you. Thank you very much, Mrs. Ezebo, for your wonderful coordination. Thank you. We
Thank you,
appreciate you.
Ma. Yes, thank you. Bye-bye.
Bye bye.